With the Beijing Olympics just days away, athletes and their entourages have been streaming into the Chinese capital from all over the world and getting a taste of China's zero-tolerance approach to COVID. The Chinese government has created a special bubble for those participating in the games. Vaccination is required, of course, and everybody in the bubble will be tested daily. Outside of the bubble, rules are even more draconian. Just a handful of cases can lead to an entire city being shut down for weeks. But are all of these precautions actually making things worse? My next guest just wrote an essay in the New York Times titled, "China's Zero COVID Policy is a Pandemic Waiting to Happen." Dr. Ezekiel Emanuel is Vice Provost and Professor of Medical Ethics and Health Policy at the University of Pennsylvania. He was a top health advisor to the incoming Biden administration during the transition. Welcome, Zeke. Let me first ask you, it's worth painting the picture, which is China's zero COVID policy has been stunningly effective so far. I mean, with their deaths are something in the range of 5,000 or 6,000. Our death rate is something in the range of 850,000, right?
Yes, we have about 150 times the number of deaths they do, and they're a country that's 4 times our size. So far on that metric, it looks like their policy has been successful, and their measures have been orderly. Ours is chaotic, I think, is the appropriate word.
But the basic point you're making, correct me if I'm wrong, is that by having this super draconian policy of just not allowing any kind of COVID, the population basically has no antibodies. There is no path to a kind of immunity, herd immunity of any kind, right? Is that the fundamental kind of medical flaw?
So I would put it 2 ways. First of all, zero COVID is based upon the notion that COVID will disappear or somehow won't be a threat going forward. If you think we're going to have endemic COVID, that it's going to be around and every so often going to surge, you need some population-based immunity. And the Chinese don't have it in part because they've prevented the coronavirus from coming into the country, but also because their vaccines are not very effective at inducing immunity. And so they don't have it either by vaccination or by natural infection. They don't have immunity by vaccination or natural infection, and that leaves them very vulnerable, just like at the start of the pandemic, to coronavirus.
Tell me about what you think the right strategy is for China right now, because they don't so far have the mRNA vaccine. So these lockdowns, which are brutal, I mean, the Chinese lockdowns are very different from the U.S. lockdowns. You literally can't leave your apartment in the entire city, and you have to eat at home. And so should they be instead allowing Omicron to kind of gradually spread? What would you do?
So Fareed, yes, we have to contrast. The lockdowns we experience in the United States and Europe are nothing like the Chinese. You are in your apartment, they shut off the elevators, food gets delivered to you, or it doesn't get delivered to you in some cases, and there are draconian measures if you're caught outside, and that lasts weeks. It can last more than 3 weeks of that, and it's millions of people, 14, 15 million people at a time, and almost all the businesses are closed. What they have to do, and you can see this in other countries that adopted initially a zero COVID policy, but now are opening up, is you have to vaccinate your population with an effective vaccine. That's an mRNA vaccine, and then slowly open, but not overwhelm the system, because even with good vaccines and booster shots, we know that people are going to get Omicron, and that some of them, not a lot, but some of them will need hospitalization, and that you want to prevent overwhelming the system. Remember, the Chinese have 1.4 billion people and about 7 million hospital beds. And unlike most of the countries we know where you can get medical care by going to a physician office away from the hospital, in China, all the medical care is concentrated at the hospital, and so people who get sick will be streaming to a hospital, and that creates its own dangers if there's too much COVID around.
Let me try to understand what happens if what you are predicting, which seems to me perfectly reasonable, which is that there will be an outbreak in China, that COVID is going to spread, particularly with Omicron. Then it starts to spread. 1.4 billion people. It's going to replicate, and where you have massive replication, you often have mutations. So there's likely to be new variants. And then China is, I suppose, connected enough to the world. I'm assuming that those mutations aren't going to stay in China. Isn't that a fear?
Yeah, that is true. And the real question is, how serious are the variants that evolve? And China's not the only place variants are happening. They're happening all over the world. Most of them have no effect. Most of them disappear. But in China, in the world, one of them might arise and be like Omicron or Delta. And that's the real fear. And that's why we're, I think, desperately looking for things like pan-coronavirus vaccines that will really be able to take care of most of them and give us immunity to almost any variant that would arise.
Zeke Emanuel, pleasure to have you on. Thank you so much.
Thank you, Fareed.